doctors and surgeons of Reddit, what was your "this just got even worse" moment with your patients? Story 1. I hope I never fucking see this again. I'm an OB-GYN resident. This happened when I was a student. 300 lb African-American female with IVF twins around 32 weeks gestation, multiple medical problems, chronic hypertension, being monitored inpatient, AM rounds. She looks uncomfortable, said she slept in a chair, just looked very anxious for no reason, breathing heavy. Blood pressure is very, very high. We give meds. We can only get one twin's heart, probably because she's so big. We move her to L&D for closer monitoring, plus ready access to ultrasound. Now she has a lot of abdominal pain, blood pressure still very high. Her breathing is getting heavier. Stat chest X-ray shows her lungs are like completely whited out, filling with fluid from flash pulmonary edema. At the same time, her abdominal pain is worse and worse. Big bright red clot falls out of her vagina. Same time, we get an ultrasound view of both fetuses. Twin 2's heart is super slow. Patient is now having a panic attack and screaming while also having trouble breathing. This is all within like 10 minutes. Stat emergency crash C-section. Get her on the table. She starts having an eclamptic seizure. Anesthesia does rapid sequence intubation. Loud. Long, steady. Beep. Patient goes into cardiac arrest on the table. Code blue. Labor and delivery goes out overhead throughout the hospital. Phones all over the floor start blowing up. White coats and scrubs sprinting onto the floor. ICU comes running. Rapid response team comes running. General surgery comes running. A double NICU team comes running. There's like 30 people in the OR. ICU is giving chest compressions and running the code. Surgery is putting in a central line. Rapid response is setting up to shock. Obgyn is doing the C-section. I remember the attending yell, "Cut, cut, cut." Obgyn goes skin to baby number 1 in about 54 seconds. There's blood everywhere, compression still going while operating. Second baby comes out very still looking placental abruption. The high blood pressure flooded her lungs and tore the placenta off the uterus. NICU takes both babies. They eventually do just fine as far as hospital course goes. Mom achieves ROSC, return of spontaneous circulation. Her heart is beating on its own now. Still bleeding. Massive transfusion protocol initiated. She eventually gets somewhere between 14 to 20 units of packed red blood cells plus plasma, platelets, other stuff. Thank you for giving blood. It actually actively saves the lives of people who wish they could know who to thank. Conservative surgical measures don't stop the bleeding. Cuvular uterus is diagnosed secondary to placental abruption. In the setting of eclamptic seizure, cesarean hysterectomy is performed. Uterus comes out. Patient remains intubated for about 2 days. Downgraded from SICU. Walks out of the God hospital after 1 week because that's how a solid medical team handles their... Now, there were a lot of red flags to indicate delivery at the beginning of this story, but she spiraled so fast, there really wasn't any significant wasted time. Story 2. I have many stories. One is a healthy 23-year-old male comes into ER with some chest pain. Normal vital signs, never smoker, normal chest X-ray. Pain started after eating something spicy, tell him it's probably GERD. 5 minutes later, he drops dead in his bed. Start CPR and get a pulse back. Stabilized, get CT scan, and has an aortic dissection, dies again in CT scan, and never makes it to the OR. The guy's major blood vessel basically just exploded. This happens to men in their 70s with a long smoking history and high blood pressure. This healthy 23-year-old had absolutely zero risk factors for this. No evidence of Marfan's or Ehlers-Danlos for the med people reading this. Still makes no sense to me. Story 3. When we opened the abdomen of this woman in her late 20s up, the entire room instantly smelled like hot, rotting flesh. The smell was like the swamps of Dagobah story for those who remember that piece of Reddit history. We were doing an exploratory laparotomy because she had such severe abdominal pain she couldn't sit still for a CT scan, and the X-ray just suggested some free fluid in the abdomen. A paracentesis, draining fluid from the abdominal cavity, didn't really do anything, so the surgeon was kind of going in blind. But her indication for surgery was the extreme pain and the rock-hard feeling of her abdomen. When he cut her open, he saw that she was going into multiple organ failure with a ton of tissue simply rotting. The smell enveloped the room instantly. Anesthesia was gagging. I ran to grab the peppermint oil to rub on our masks. The surgeon looked at the abdomen for about 20 seconds and said, "Well, anesthesia, I think she's about to crash. I imagine this pressure in the abdomen was the only thing giving her any blood pressure." She did crash, and she died there on the table. This young woman had been an extremely heavy meth user. Her mom had started her out using meth with herself when the girl was a teenager. They figured she probably got a bloodstream infection from injections with dirty needles, and that just spread through her body like wildfire. Edit. I'm the OR nurse that was present for the case. I wasn't in charge of any diagnostic testing or any preoperative emergency care. Com.R AskReddit comments, JXO41D doctors, nurses, redditors, what has been your most C5066P2 UTM source, share and UTM medium, iOS app UTM name, EUSF in context 3. Story 4. My father went to hospital with chest pains. They decided to do an angiogram. Dye injected, he's lying under. The machine and the surgeon suddenly changes his procedure. Are you okay? Feeling well? Any blackouts? No, he replied. Just pain. A few more docs come in and are looking at the screen. They take him to another type of X-ray machine and again are looking in bemusement without explaining anything. You have a blood clot the size of a golf ball floating free in your heart. It's bouncing around the valves, and we would expect you to have died very quickly from this. So they give him super strong clot busters, but were concerned it might shrink enough to get jammed. A lot of experts turned up. But all went well and he had a triple bypass a few months later. That was 30 years ago. He's 87 now and can walk with ease up steep hills. Story 5. Patient came complaining of swelling in face. We suspected an abscess from a sick tooth. When they came, we called 911 immediately because the swelling had almost completely cut off her airway and her O2 level was a 77. A PSA to all, if you have a cavity or a broken tooth, it is a big deal. A rotten tooth can absolutely kill you. Story 6. Eye doctor here. You may have heard that diabetics need to have their eyes checked regularly because diabetes is actually a blinding condition. This happened probably about 15 years ago, but this patient of mine I had noted had severe diabetic vascular changes against the retina and required laser intervention as soon as possible. Without getting into the socioeconomic arguments here, she scheduled her surgery and on the day of the surgery decided to take a workday instead of her surgery. Her job was cleaning, and on that fateful day, she inhaled some of her cleaner fumes which caused her to sneeze, spiking her blood pressure, and she blew the fragile blood vessels in both of her eyes wide open and blood started gushing into her eyes. As you might imagine, blood is opaque. You can't see through it. She was instantly and completely blinded in both eyes in a matter of seconds. It took 3 years, multiple surgeries, and a complete lifestyle change, but this patient did recover to have actually fair, but not good, vision. I still see her now for her annual visits. Story 7. A little late to the party, but I'll chime in. When I was a medical student on my surgery rotation, I was working a 24 and was with the trauma team. I'm observing a simple repair of a duodenal perforation in the OR when my trauma pager goes off. Ask my senior if I can leave to see what's going on and he gives me the go-ahead. Run into the trauma bay and a youngish gentleman is brought in on a stretcher with the lower half of his body covered in blood, but very obviously awake and coherent. He's screaming, they shot my fucking man. And they had. He had been shot 15 times all below the belt, one of which had gone straight through his. We're doing an evaluation on this distraught man when a code is called in the next pod over in the ED. That's weird. They usually don't call overhead for codes in the ED. Someone pops their head into the trauma bay. It's the patient who was brought in with this guy. Oh. Several of us run away from stable shot guy and into the next pod to see a young woman lying on a stretcher receiving CPR. What happened? We don't know. She just crashed. Go to roll the patient to get her clothes off and we notice she's bleeding out of her back out of the tiniest exit wound. She was an unintended victim of the drive-by. She's now our patient. We take her to the trauma bay and immediately take off all her clothes to perform the primary surgery. She's not breathing and has no pulse. Intubate. Sure as once we get her entirely exposed, we see a very small entry wound right into the center of her chest. Ultrasound confirms massive hemothorax, place a chest tube, and 2 liters of blood gush out onto the floor. "Oh, we need to convert to open," says my attending. Resident I'm with immediately takes a scalpel and creates a longitudinal incision along the inferior aspect of the rib spaces and uses a pair of medical gardening shears to clip the sternum in half. Basically, the patient has had their chest pried open horizontally in a crazy procedure called a clamshell thoracotomy. Look it up. At this point, we can visualize the heart and notice there was a clean entry and exit wound straight through this patient's heart. All of the blood and fluids we were pushing were just draining right out of her heart and into her chest. Surgical attending is performing manual cardiac massage, CPR with your hands on the actual heart. We need to go to the OR. Rush down to the OR with this patient, and the attending attempts to sew up the holes in her heart. Just as she's putting the final sutures into the patient, I begin to notice the patient oozing blood from every single opening in her body. "Doc, I think this patient is in DIC. "Oh. Patient is now floridly experiencing a phenomenon known as disseminated intravascular coagulopathy, DIC, which is basically when you use up all of your clotting agents and just bleed out of everywhere. Okay, we need to close for now. Patient is transferred to the SICU, where I monitor her progress for 3 fucking weeks. She has watershed infarctions across her entire brain from how long it went without perfusion. She can't talk or move. Having end-of-life discussions with the family about a young woman who isn't even old enough to drink. I leave the service and follow her, until one day I don't see her name anymore. Next day, I'm in a surgery with the trauma attending, and she says, 'Hey, our shooting patient went home today. She's a quadriplegic, but she's alive.' 'That sucks,' I respond. Fast forward 6 months and I'm working in the SICU again. I bring up this patient to a neurointensivist attending because I think it's a cool story. Her eyes opened so wide. I saw that patient in the ICU and told the family she was going to die. When she didn't die, I told them she would be a quad. Then a month ago, I had a follow-up visit with her, and she walked into my clinic with nothing to show for her experience except a scar from her thoracotomy. Edit. Can I put a plug here to beg at least one of you to donate blood, plasma, or platelets? This young woman used nearly 20 units of blood products. We need your help. Story 8. I am not a doctor or surgeon, but I did work in healthcare, and this was in an urgent care setting. Should have been an ER visit, though. I was assessing and taking information down for a 25-day-old newborn. The parents were very young and concerned that the baby wouldn't stop crying and never settled. I tried to calm them and reassure them we see this a lot. Baby seemed a bit feverish and red, so I took temp, and it was slightly elevated. You definitely don't want a newborn so young with a fever, but sometimes it's not very serious. I noticed one leg appeared possibly clubbed with the foot, but that was not what they were there for. The doctor returned after seeing them and said, "Baby was going to radiology right away." That's not good. X-rays come back and it's realized the one leg that appeared off to me was actually a broken femur. The doctor described it as, the only possible way for this to happen was someone had to have grabbed it and twisted hard. Suddenly, we are making a temporary cast to splint this tiny, not much bigger than a bratwurst-sized thigh, and loading the car seat on a stretcher for transport. Police arrive, and the grandma came crashing through the doors screaming at these parents about how she's going to kill them for hurting her grandbaby. It was a little chaotic, but very depressing. It was long ago, but I still wonder about that one. Story 9. So many. The 80-year-old who came in with a self-inflicted shotgun wound to the chest. As we are fighting to get him stabilized and the surgeons are working to plug all the holes, none of us can figure out why the guy keeps oozing blood. Then we find out that he had intentionally overdosed on blood thinners before shooting himself. We kept him alive long enough to let the family come into the OR and say goodbye. The 45-year-old who came in via private car, family drove him in, rather than an ambulance, after what was described as a head injury. We realized how bad it was when someone noticed a plastic grocery bag lying on the patient's belly. It contained the brains that the family managed to scoop up, in the hopes that we could reimplant them. The 30-something meth addict who also had a permanent catheter infusing life-saving medication directly into his chest for pulmonary hypertension. He came into the ICU with pH crisis, and then we found out why. He had been injecting meth into the catheter, creating a hole through which his life-saving medication leaked out. Medicine is a lot of things. Sometimes it's just tragic. Story 10. Was coding a patient in room 1. I bring the family in before I call the code if they want, so they get a chance to say goodbye before I stop. Wife was clearly gone, had probably died hours before. Husband comes in, sees her laying there, grabs his chest and down he goes. His was a ventricular arrhythmia, VT, VF, ultimately resuscitated. I saw him a year later for something unrelated, and he thanked me for saving his life and told me he wished he hadn't lived. BC life without his wife wasn't worth living. Story 11 nurse here. Midwife let a mom go through over 8 hours of the pushing stage of birth, to the point the mom went into severe decompensation. Blood pressure plummets, saturation drops, fetal distress, etc. In Canada, midwives practice separately from doctors and nurses. They usually just have an agreement with hospitals to use the beds, although medical care is available if the delivery becomes high risk. Doctors take over and go in for emergency C-section. Realize the arteries in the sides of the uterus are ruptured due to pulling away from the strained uterus and extensive pushing. Baby came out fine, but they had to work on mom. Finally close her up only for mom's pressure to plummet again. They open her back up and realize another artery was bleeding, so they clamped her aorta until they could repair the damage. I.e., her lower body didn't receive blood flow for several minutes. They replaced her blood volume at least 3 times throughout. Finally, the team stabilized her, but were afraid of anything else unexpected, so they packed her but left the wound open, then sent her to ICU. I received baby in NICU. Baby was okay. Mom survived, although didn't find out much more. Story 12. I work in a cancer center, and fairly regularly a patient with multiple cancers will get a biopsy of a lesion trying to figure out which cancer has metastasized, and it instead turns out to be a totally different and unexpected cancer. Story 13. Not a surgeon, but my dad is. One patient who attempted suicide was put on suicide watch for a while. Said he was fine, slowly got taken off suicide watch. He asked for permission to go alone to the cafeteria and eat. Got that permission. Took a knife from behind the counter and slit his own throat. You have no idea how much blood there is in the human body until someone cuts deep. My dad described the scene like something from a horror film. Story 14. My teacher works in a health center. She deals with teeth, hygienist, and they found out that the newbie and a senior worker, someone who had been there the longest, didn't turn the autoclave on, meaning they had been using unsterilized equipment on quite a few patients until my teacher noticed. They then had to call every single patient they had that day, or that batch was used on, and had to get the office to pay for every single one of them to get tested for STDs and other bloodborne diseases. Everything was negative, but I feel like this can fit here. Story 15. Pick 1. These were all from my intern year in general surgery in the late 90s. 1. The beautiful 34-year-old woman who manned a grill for 2 days during some sort of weekend festival for her church. Her eyes got irritated from the smoke off the grill, so she asked her PMD for some eye drops. After using them for 2 days, she developed a rash. They were tobramycin drops that rapidly progressed to cover her whole body. She developed TENS, aka toxic epidermal necrolysis syndrome, which essentially means the most superficial layer of the skin, epidermis, separates from the deeper layers, dermis. This leaves a wound that is similar to the raw spot underneath a big blister, but in her case it involved nearly 75% of her skin. She also developed GI bleeding, as the mucous membranes, the moist tissues that line the inside of your mouth, esophagus, stomach, and intestines, also separates and bleeds. At the time, we had silver-impregnated dressings, Acticoat, that we had to wrap her in like a mummy and change every day. Despite everything we could do at the main burn unit in a huge metro area in the Midwest, she died. 2. The husband and wife who were brought in at the same time, both with major flame burns. He was about 50% TBSA, total body surface area, and she was 75%. The woman was intubated at the original ER they went to. Big burns are literally hot potatoes and will get transferred to the nearest burn center ASAP when they arrive in a small town ER. She was waking up a bit when she got to our unit and kept trying to mouth something around her breathing tube. In hindsight, I'm pretty sure it was my baby, as she miscarried about 36 hours after she was admitted. Her nurse found the fetus in her bed. She developed an arrhythmia while we were starting a new central line, big IV in the neck or chest, and we couldn't stop it. And she died. We later found out that the husband put their 2 kids in the car, then went back inside and choked her till she passed out. and then poured gasoline all over her and lit her on fire after he found out she was pregnant with someone else's baby. He also caught on fire. Gasoline will do that. He survived, got multiple skin grafts, and went to jail. The kids were uninjured, physically. That was during the first 3 weeks I was a doctor. Edited because mobile format is hard and to clarify what happened to the husband and kids. Story 16. Obligatory, not a doctor, but I was a forensic technician assisting forensic pathologists at autopsy. One day, the chief and I were doing 3 routine narcotic OD autopsies. Oftentimes with ODs, our doctors would let us, the techs, do the whole evisceration to save time, so all the doc had to do was to examine the individual organs. So on the third decedent, she gave me the green light to start cutting. Once I had the chest plate removed, something didn't look quite right with his lungs. I called over the doc and she takes one look and goes, "I really hope you have your mask on as tight as it can possibly be." Her next words were terrifying. "That's tuberculosis." We immediately had to inform the Public Health Commission, kick everyone else out of the autopsy room, and convert our deco room, where we primarily did the exams of decomposed people, and turn on the extra duty ventilation system and had to complete the exam with the full PAPR kit on. That was fun. Story 17. Homeless man is brought into the ED by EMS for a foot wound that is giving him trouble. We eyeball his foot that's poking out from the blanket as he's rolling by, and it's a little roughed up, but doesn't seem too bad. We go in to get his story, and he says he hurt his foot a few days ago, and that it just hurts to walk on. We ask if we can take a peek, so he whips off the blanket to show us his other foot, the one that is actual hurt, releasing a horrific stench cloud in the process. We knew we were in for a treat. Guy has his foot bandaged in a very dirty ace wrap, toes are completely black and necrotic, and there's a maggot butt wiggling near the edge of the ace wrap. We tried to remove the wrap, but it was stuck together with blood, dirt, and who knows what else, so time to cut that sucker off. As we cut more, maggot began to present themselves, and the smell of dead flesh just kept getting more and more intense. We finally make it through and go to pull away the wrap, and I swear, at least 100 maggot fell out of that thing. But that wasn't the worst part. The entire bottom of the man's foot was stuck to the wrap and just fell away from the underlying muscle and bone. We told the man we were unfortunately not going to be able to save the foot, to which he responded, "Oh man, really? I didn't think it was that bad." Story 18. I'm a mother-baby nurse. Our patients usually get discharged 2 to 3 days after delivery. This one mom came back a week later with her baby saying that she couldn't get the baby to eat. I told her we couldn't admit her directly to the floor, that she would have to go to the emergency room. I escorted her to the ER and helped them start an IV. The baby was admitted to the NICU for dehydration, low blood sugars, and sexual assault. At 8 days old, this little baby had been sexually abused so much that she stopped eating. Failure to thrive. Yeah, I wouldn't want to thrive if that was my life either. Edit. Child Protective Services was obviously notified. The baby was transferred to another hospital for safety reasons, so I don't know for sure if she made it. I like to think that she did and was adopted by a family who loves her more than anything. If the mom had changed the baby's diaper at all in that week, she would have known what was going on. So I think that she did know, but I don't think she was the abuser. She seemed genuinely concerned about the baby and loved her enough to bring her in for help. Story 19. I once had a patient in the ER who complained about a foot wound who wasn't healing, and something in the wound was wrong. As I started to smell it, I thought, well, here comes another diabetic foot. But then I removed the bandages and started to see fly larvae crawling around. Had to swallow hard. Story 20. A young newly married couple moves to town. He gets a good job, but gets admitted to my ICU with terrible pneumonia. Didn't take too long to figure that he AIDS-associated pneumonia, what we now call HIV. We didn't then know how to treat it, so we had to tell the soon-to-be widow that she was soon to be a widow. Then we told her about how HIV is transmitted, and she needed to be checked. Not a good day. Story 21. Not a doc, but I used to work for radiology in a small hospital and was their kinda Mr. Everything we don't want to do. Lifting, security, transport, babysitter, etc. A young mid-20s couple gets brought in on backboards after a car wreck. Middle of February, ICAF, and the guy rolled the car. The girl gets a bed in the ER. She's mostly fine, beat up quite a bit but still coherent and talking. A state trooper is in her room with her. The dude is complaining but overall seems fine. She's asking me to see him and I tell her that they're stabilizing him and he's not going anywhere. She says, "What does that mean?" Over and over again, and I tell her that he's in a bed on a board so he can't move. She's freaking out. I take the guy back to radiology. He's talking and joking. Things seem fine. We do the CT and his spine is broke. Not just broke, severed. Guy is in for some serious surgery, rehab, might never walk again kind of stuff. The girl runs out of the room, cop chases after her, they start fighting. A little 110 lb girl is straight up squaring up with this big cop. Cop ends up tasering her in the middle of the ER. Her dude is screaming because they told him about his spine. His girl is now chained to a bed. Turns out they were running drugs, high as eagle. Flipped the car and the dude probably never walked again. I always wonder though. Story 22. It was a surgery rotation when I was still in medical school. Middle-aged lady brought in unconscious, pale, and possibly bleeding internally because she stabbed herself multiple times in the abdomen because her husband cheated on her. We immediately cut her abdomen open trying to find the source of bleeding. After a few moments, we were able to stabilize her and checked every segment of her intestines for any bleeding. We located a few and were able to cauterize and suture and whatnot. There was actually one stab wound that missed a major artery by millimeters. As we were placing back the guts into the cavity, my chief resident decided to take one more look underneath, and he accidentally opened up a big artery, most likely had an initial slight damage to it due to the patient, and it started bleeding like crazy. Reminded me of that famous scene from The Shining. We had to call the chief surgeon stat, even though he was on vacation, but he answered and was calm and told us what to do in a calm manner via the phone. I was so scared shitless, really thought the patient was a goner when I saw that massive hemorrhage happen before my own eyes. We were able to control the bleeding by a combination of aggressive cautery and some pressure and suturing. Definitely something I won't forget. The patient was able to live, and I was able to talk to her a few days later as she recovered in the ICU bed. But man, that was a crazy experience in the operating room. One of the more action-packed day as a medical student. Am now a graduate, planning to land a residency somewhere this cycle. P.S. Just remembered that this was my very first day of surgery rotation ever too. Edit. OMG. First time a post-sock comment of mine blew up this much. I appreciate all the likes, comments, awards so much. Wow. Edit 2. A lot have been asking how the patient was after the event. She was a bit confused and down. When she was able to speak, I was actually dumbfounded to find out she was actually unhappy she lived. She was placed on suicide watch for a few weeks, and most likely discharged. I actually never followed up after that. I hope she recovered and never attempted to kill herself again. But it could have turned out completely differently. We can only try, the rest of the story depends on the individual in the end. Edit 3. A few have been asking whether the bleeding was either caused by the resident or was it a good decision to poke around there second time around. This was a double-edged sword. Both the resident's decision and pre-damaged vessel might have contributed to what happened. When it first happened, first thing that hit my mind was, oh shit, this resident is in some deep trouble, because the artery bursted when he was moving the artery with his finger, literally just burst open like a cracked pipe, and the abdominal cavity just started flooding with blood. But after some discussion, we came into conclusion that it was a great thing that this happened so that it did not occur while we already closed up the patient. The resident had to come up with a reason other than, that was my bad, or he was definitely in deep for sure. Story 23. One of the worst things I've ever seen in healthcare. Young woman in her 20s comes in with an infected heart from injecting drugs. Her infection and heart failure are pretty much past the point of recovery. Her only option was basically IV antibiotics, hope they work, and if they don't, go to hospice. The antibiotics get the infection somewhat under control, but the heart valve damage is too much. Her heart starts throwing little microclots. Her fingertips got purplish, and she eventually throws clots to her lungs and starts struggling to breathe. She comes to my ICU, charge nurse at the time, for BiPAP. She decides to make herself a DNR and proceed with hospice. But in my state, DNRs and living wills don't mean once you become unresponsive and your family member takes proxy. Her mom, who she was not on good terms with, went to court to receive healthcare proxy rights once she became too disoriented to maintain capacity for medical decision-making. Mom rescinded her DNR. We intubate her. She spends weeks, months, on the ventilator throwing clots despite heparin. Her arms and legs become purple, black, green, necrotic. Her abdomen even started to break down and come necrotic. She threw clots to her brain and became totally unresponsive, no longer requiring sedation. We took the case to risk management, we held ethics meetings, we went to court against the mother to revoke her healthcare proxy to fight for the patient's right to die with dignity. The court refused. Mom remained proxy. The patient eventually coded. I initiated CPR and ran her code with the physician. Performing CPR with so much necrosis was beyond disturbing. She did not survive. Things became problematic in the morgue a few days later. I had to go to the morgue and add a secondary body bag to contain everything. Story 24. ER doc here. Patient arrived with complaints of vaginal spotting. History revealed she had been bleeding for 2 days. Not very heavy, just a little pain. Stated it started after her female partner had been a little rough during their last sexual experience. Physical exam revealed a complete tear through the posterior vaginal wall into the rectum, consistent with what we would usually see during a difficult childbirth. The situation was a bit fishy, given the amount of trauma and the backstory, so I ordered the usual tests: blood count, coagulation panel, chemistries. In accordance with OR protocol, she was definitely going to surgery, tacked on a urine pregnancy test, even though she denied the possibility of pregnancy given her sexual preferences. The pregnancy test came back positive. Needless to say, this opened a huge can of worms. Turns out, she had delivered a child 2 days ago in secret but didn't tell anyone. Had been hiding the child from her family or girlfriend. Child Protective Services, the police, EMS, pediatrics, ON-GYN, all got involved in the matter of minutes after that revelation. They found the child in her apartment under some towels alone in her home. It was a doozy of a night. To those who are wondering, yes, she was a larger woman whose pregnancy was hidden by her size. This happened 5 years ago, and I have seen the child since, doing well with her grandparents who have full guardianship. Story 25 used to be an EMT. We were too far away to respond when this happened, but we heard it over the radio. Dispatch. Caller reports 2 children playing with garage door spring, reporting unknown injuries. Dispatch. Responding LEO, law enforcement officer, reporting possible juvenile fatality. EMS. EMS reporting juvenile fatality. We're gonna need a cleanup crew. It's a mess here. Can we get someone to confirm an injury's not compatible with life? EMS. Yeah, we're gonna need another crew here. Kid was playing with a garage door, the spring snapped or something, and his face is gone. Dispatch. EMS, please repeat. What did you say? EMS. There's brains on the wall. We need another EMS rig here. Dispatch. Roger. I'll have another crew en route shortly. The tone in everyone's voice when talking about that on the radio is something I will never forget. The absolute pain in the voice of everyone after they heard one of the responding EMTs say that the kid was killed like that. Story 26. I worked as a medic back in the day, specifically a mountain medic at a ski resort. Most of the time, like 90% of the time, it was people who feel on the mountain. About the most exciting thing was a broken femur, in which case they were getting their pants cut off. On a rare occasion, you would have other medical events, but most people on skis are fit and healthy adjacent. Most of the non-accident stuff happened at the lodge, and since the fire station was literally across the parking lot, they would just call them first. Their jump bags were better equipped for medical rather than trauma. They got called in a heart attack and weren't in the station because they were transporting to the hospital. A lady in her 40s had slipped and fell on some ice. She appeared fine, but we needed to medically clear her, so they called us down mountain from our clinic at the upper lodge. I have no idea why I grabbed it, but I threw our cardiac bag in the leader and we ran down on the snowmobile. I didn't think I would need it, and because typically we have to transport someone in the leader, we don't pack it unless the call seems we might need it. So I get to her and start asking questions, palpating for broken bones or dislocated joints. Quick neuro, and she seems fine, but there is just the slightest weakness in her left arm. I probably would have thought nothing of it because everything else was fine. But then I asked her history and current symptoms and my partner just flashed me BP. It was odd. But then she mentioned she was taking Tums. I asked why she'd woken up that morning with really bad heartburn. So I insisted she come with me to a private clinic room we have. It's really just a cramped closer with a few chairs and a desk. She refuses, but I insist. I tell her I want to put a 4-lead ECG on. She's insistent that I don't, but I finally convince her that I'm not a doc. So I'm probably just being paranoid, but I really just want to be careful. So we pop her shirt open and quickly get the leads on. And yep, she's having a heart attack and it's pretty bad. I have no clue how she's standing, but women tend to have less of the big early symptoms and are tough as nails. So we get in a helicopter and down to the cardiac center. The air medic always passed me back status on my bigger patients. I like to know when I saved a life. She survived, but if she had waited till it was bad enough for her, she would have died before she would have gotten to a hospital. So, a minor slip and fall of a healthy young woman saved her life. Story 27. Hospital social worker here, we get called when things go from bad to worse in other ways. My first day as a student social worker in the ICU, we had a family meeting for a patient who went to his local emergency room for shortness of breath. Turns out his cancer was back with a vengeance and tumors were blocking his airway and surgery was not an option. He was brought to the ICU and had breathing tube inserted, but he kept pulling his tube out in the night. The guy was deteriorating fast and he communicated to us that he wanted to die. Well, a different kind of complication arose. His young adult children informed us that their mom was on life support in another ICU one town over after having a massive heart attack. Her prognosis was somewhat unclear but better than her husband's, so my supervisor, with my extremely wide and teary-eyed self in tow, went to tell the patient that his wife had a massive heart attack and that she couldn't come see him before he died if he agreed to a one-way extubation, meaning the breathing tube isn't going back in if he pulls it out or the team takes it out right away. However, the best ICU team ever had a plan. They brought his wife to our ICU so they could see each other before he died. It was a huge undertaking that required a lot of resources, organizing, and skill, but they got her there and they were reunited for a short period of time before the husband died. She didn't have any memory of being wheeled into her husband's room, another huge production, but they had pictures that she could see. She did eventually wake up and recover somewhat, and we had to have another very hard conversation with her about how she ended up in another ICU and that her husband died. But those boys didn't lose both their parents in one go, and one man died knowing that his wife was being cared for in the next room. That was my first week in the ICU. Bad got worse, but then it got a bit better. My supervisor had a quote framed in her office that said something to the effect that hope springs eternal, but sometimes we have adjust our hopes to meet reality. Meaning, sometimes we can't hope for recovery, but we can hope for a peaceful and safe end for ourselves and the ones we love. I work in social work research and policy now, but I wouldn't trade my time working in the ICU. I worked in the same ICU after I graduated too, for anything. If this story sounds familiar, it made local news when the children took the story and photos to the Kingston Whig Standard, and then major news outlets picked it up.